Hi, this is Dr. Jackie Akande. I'm a GP in practice in the UK, and I'm talking today about hypertension. This is from reading from a PDF from a leaflet from GP Wales, GP update course that I attended. And the reason I'm doing this is to, as you read or discuss something, you tend to get better understanding of it. So for you to gain, if I decide to share this with you, and also for me to gain, so we can help each other as GPs, especially as we prepare as a CPD, continuous personal development to increase our information for ourselves so we can help our patients. Okay, so hypertension. Hypertension is not a disease. It is a risk. It's a risk factor for cardiovascular disease. What's more, unlike age and sex, it is a modifiable risk factor. That's really good. So it means that we are in control and can tell our patients that they're in control. So why does hypertension matter? Our understanding of hypertension is based on trials. It's based on trials. It's based on trials that are often decades old. A massive study reviewed contemporary data on hypertension and challenges some of our assumptions, which is very interesting. The study looked at 1.25 million people over 30 years of age. None had cardiovascular disease at the start, although 25% were on antihypertensive. This is according to Lancet 214. Pages. You can see the pages there, 383 and 1899. The study showed the following. It's very interesting. There was no J-shaped curve for blood pressure. Those with the lowest blood pressures are not at risk compared to those with a blood pressure of 90 to 114 to 60 to 74 diastolic. So let me read that. It says that the J curve, there was no J-shaped curve for blood pressure. Those with the lowest blood pressure are not at increased risk compared to those with a blood pressure of 90 to 114, that is systolic, and diastolic of 60 to 74. Remember that in Europe, many of these individuals are offered treatment for their low blood pressure to make it higher. Oh dear. So these are the facts they found. They found that those who develop hypertension, that is when the blood pressure is 140 over 90 or more, developed cardiovascular disease 5 years earlier than those without hypertension. So the other thing is that the commonest hypertension-related diseases people develop were heart failure and angina. Those are the commonest ones. And then the other fact they found is that the attributable risk from hypertension varied from one cardiovascular disease to another, and varied whether the systolic or the diastolic blood pressure was raised. So systolic and diastolic blood pressure give different, gives you the risk, makes you a risk factor for different diseases. For example, they found that high systolic blood pressure increased the risk of getting angina and intracranial hemorrhages the most, whereas the risk of developing abdominal aortic aneurysm was linked much more to diastolic blood pressure, with little impact from systolic blood pressure. So we'll have a look at what GP has done. It says well done. So they found also from 1994 to 2011, a cross-sectional study in England showed that, this according to Lancet 2014, 383, the average blood pressure for those with hypertension has fallen from 150 over 80 to 135 over 75. That's really good. So the prevalence of those with controlled blood pressure doubled from 35% to 63%. I think, we GPs or primary care should take credit for this, especially if, you're saying you're practice nurses, if your practice nurses are the ones who do this. So, but however, a survey of 300 GPs found that more than half of GPs in 2014 were not using the correct thresholds to make their diagnosis. Most of them were using higher thresholds and therefore underdiagnosing hypertension. In part, this was because they were adjusting by 10 over 5 for home readings, as we used to, but we shouldn't anymore. This according to the BGGP 216. Okay, the other ones you can see there. So I think it's time we need to have a quick check on our protocols and see what it says. Yeah, about our blood pressure monitoring, so we can diagnose this illness and control it. So blood pressure, patient's view on blood pressure. I'm going to keep this videos just up to 10 minutes so that it's easy to consume. So patient's view on blood pressure. What do patients think about blood pressure? So there's a systemic review on the literature raised of some important points. That's BMJ 212, 345, E 3953. Patients think the main causes of blood pressure are stress, food, obesity, family history, alcohol, and alcohol. Stress in particular was identified as the key element, as a cause, as an exacerbator, and as a consequence. Many described trying to avoid stress after the diagnosis, avoiding arguments, changing jobs, trying to relax more. Some thought hypertension was a temporary illness and that it would resolve. Most knew hypertension caused stroke and heart disease. Fewer knew it affected the kidneys. So the main symptoms patients associated with hypertension were headaches and dizziness, and most felt the absence of such symptoms showed good disease control. Many had experimented with stopping treatment to see if any symptoms recurred. So lack of symptoms to patients often prompted people to stop medications. Presence of symptoms encouraged compliance. Many expressed fear that long-term medication was harmful because there was a risk of dependence, or drug buildup to harmful levels. Alternative medicines were widely used and perceived to be more effective. So it's worth bearing in mind the next time we do a medication review for hypertension, or we talk to a newly diagnosed patients, so we can discuss their beliefs or their views on hypertension, so we can help them. And then one common question patients tend to ask is, are they at risk factors? Are they at risk because they have hypertension? Are they at risk? Because their parents have hypertension, sorry. My parents have hypertension, am I at risk? So let's look at that question, the answer to that. Data from the children of the Framingham cohort suggests that family history does have an influence, but age matters, according to BMJ 217, 357. The study showed that those whose parents had developed hypertension before the age of 55 were at an increased risk of developing hypertension themselves. Double the risk if one parent affected, and 3.5 times increased risk of if both parents affected. So those whose parents develop hypertension after the age of 55 were not at an increased risk. Okay, so this is we're not at an increased risk. We've come up to almost 10 minutes. So we'll continue in the next video talking about hypertension in GP practices and how we can help our patients. Okay, so this is Dr. Jackie, and I'll see you in the next video. Thank you for listening. Bye.